Good morning to everyone. When you go to see a doctor, what do they usually ask? They will inquire about what's your feeling, what is your symptoms, and many other questions. But do you know that why you can get sick? Maybe your answer is because the virus and bacteria like COVID-19 around us. But do you know that the environment we live in could also impact our health? Like the food we eat, the quality of our living space, and the building around our homes could all impact our health. At this moment you will ask, why doesn't doctors ask this question about these factors and address these factors? That's precisely what I'm discussing the topic today. Hello, my name is Yu Xin for L6B, and today I'm going to discuss the topic is what causes us to be sick. We often turn to the doctor when we want to be healthy. But do you know that health doesn't really start before entering the doctor office? It starts where we live, sleep, play, learn, and much more. Where we spend most of our life. According to the World Health Organization, at least 12.6 million of people die each year due to preventable environmental causes. People who live in the urban areas are exposed to environment threats such as inadequate housing, sanitation, poor water, and waste management. Nearly 90% of the urban areas breathe air that falls to meet the WHO, that is World Health Organization guidelines. So how does the healthcare system solve this problem? So that I will introduce a story it's well known in the public health called the Upstream story. Imagine when you are walking with 3 friends by the river, and suddenly you see many children struggling in the river with a waterfall at the end of the river. You and your first friend immediately rescue as many children as possible. Your second friend decides to make a raft so it could help more children to reach safety. Despite your effort, you find out, you're saving fewer children than you hoped. At that moment, you're looking for your third friend. You see, your third friend is walking upstream. You shout, "Where are you going? We still have many children here to save." The friend replies, "I want to figure out why so many children fall into the water." In the healthcare system, the first friend represents the ICU doctors, specialists, and the emergency rescuers, those who are working in the front lines. The second friend represents clinics and healthcare workers, those who provide us checkup, follow-up cares, and preventive services. But most often, we need is the third friend, those who focus on the upstream factors. The healthcare system needs more upstreamists those who look beyond and immediate symptoms to understand and addressing root causes of illness. By understanding and addressing these factors, these upstream factors, we have the power. We have the power to build a more healthier environment, not only for us, but for our community as well. So let's work together to build a healthier life, to build a more healthier environment. Because true health begins long before we step into the doctor's office. That's all for today. Thank you.
The third person represents the upstream.
Yes.
And what can you hear? Like, who are they? Are they the policy makers?
Yes. It's, yes.
Okay.
Policymakers and healthcare providers.
I have a question.
Yes.
Why is it important for the healthcare system to address these upstream factors?
It is important because that the upstream factors, like the food we eat, the air we breathe, the condition of our house, could all impact our health. At this moment, when the doctors only focus on the treating system, people who continue to get sick due to from preventable conditions. When looking upstream, healthcare providers and policy workers can work together, improve living conditions, reduce pollution, and create a healthier communication. Communication.